Freely Dominic Frangelionar, a first-year nursing student at Southwestern University of Finma. Today I'm going to perform the assessment in the fundamentals in bed bath. First is we're going to prepare the client and the environment. Next, we're going to wash our hands. Next, we identify the client by asking the name and the birth date of the patient. Sir, can I ask for your name and your birthday? Next is we're going to explain to the patient about this procedure. Sir, I am going to wash your overall body. Next is we provide privacy and we offer bedpan and urinal if the patient needs to. Sir, do you want the bedpan and the urinal? Next, we're going to assemble all the equipments and we prepare the position of the patient. We're going to remove the bed blanket and exchange it with a bed bath cloth. Next is we're going to assist the client with oral care, sir. Assuming that the client has a toothbrush, so he will brush the teeth. He will brush his teeth. After that, we are going to remove the patient's gown, assuming that the patient has a gown inside. Next, we're going to place a towel over the top edge of the bath blanket. Next, we're going to make a mitten to wash the eyes of the patient. At first, we're going to rinse it with water. Then, we're going to form a mitten. We're gonna wash the eyes from the inner eye up to the outer. Then we rinse. After that, after cleaning the eyes, we're going to clean the face of the patient. Rinse. And last, the nose and the ears. After that, we're going to dry the patient's face using bath towel. Next is we're going to wash the arms of the patient. First, we are going to put the bath towel under the patient's arm on the farthest end. So we're going to open the bath blanket. We're going to place the bath towel under the patient's arm. And we are going to form a mitten. And again, wash the patient's arm from the fingertips down to their axillary. Next, we're going to dry. And then we're going to rinse the towel. And we are going to raise the hand and wipe the armpit. And rinse. Then we dry. After drying, we're going to apply deodorant. Assuming that I am holding a deodorant. After that, we are going to submerge the hand into a basin full of water. Submerge for 2 to 3 minutes, and after 2 to 3 minutes, we're going to wash the hands of the patient, the fingertips, the fingernails. And then we're going to remove the basin and dry the hands of the patient. After that, we're going to move to the other side. side. And we're going to move to the other side. Put the bath towel under the patient's arm. Then we're going to wash it from fingertips to axillary. Fingertips to axillary. Then we dry. Then we raise. Again, we will use the mittens. We're going to raise and wipe the armpits of the patient. Next is we're going to dry. After drying, again, we're going to add deodorant. After that, we remove the bath towel and we cover. Next is we're going to wash the chest of the patient. First is we're going to put a bath blanket covering the chest and both of the arms. Then we're going to remove the bed blanket under by slowly so we cannot expose the body of the patient. Then using mittens, we're going to wash it side to side with one hand pulling the towel and then one hand, the dominant hand, wipe, wipe, wipe. Then we rinse, then we dry. Next is we turn the bath towel lengthwise without showing the body of the patient. And then we're going to move this to the perineal area. Then again, we're going to use mittens to wipe side to side slowly, using the dominant hand, using the other hand to raise side to side. After that, we're going to dry. And then we're going to cover up. And we're going to remove the bath towel. Next is we're going to perform cleaning the lower extremities of the patient. First is the farthest leg. We're going to expose carefully so we can't expose the private area of the patient. Next is we put same with the arm, we're going to put a bath towel under the patient's lower extremities. Next is we're going to form mittens. Wash from the tip down dito. Wash. And fold the patient's feet. Wash. Wash. Avoid the back of the cuff of the patient. After that, we're going to dry. Then we're going to put a basin of water and we're going to submerge the feet of the patient. So let it soak and then we're going to wash. Secure the between the toenails. Wash and then after remove the basin. And then we dry. After that, we're going to close, and remove the bath blanket. Position. Next, we're going to proceed with the same steps onto the next leg. Expose. And then put the bath towel under the patient's leg. Then we're going to form mittens. Then we're going to wipe. First we're going to fold, then wipe from the distal to the proximal. Again, avoiding the back of the calves of the patient. Next is we're going to dry. Then again, we're going to put a basin on the feet of the patient and submerge it. Wash the feet of the patient. And then dry. After we are done washing the lower extremities of the patient, we're going to proceed with the back. We're going to ask the patient to position in a side line. Sir, can you please assist me? We're going to cover the other parts of the patient's body, only exposing the back. Next is we're going to wipe the back of the patient in long strokes from the neck down to the rectum to the anus. Wipe. And make sure that the folds of the anus is well thoroughly clean. Wipe. Next rinse. Long strokes only, and then we're going to dry the back of the patient. After that, we're going to close and ask the patient to proceed with the normal position. After, assuming that I perform the perineal hygiene, since the patient is a male, I'm going to clean the penis using a circular motion. After that, I am going to assist the patient on clothing. This involves assisting the patient with their hair, their makeup. Next is we're going to assist the patient with their hair. We're going to ask the patient if there are any products to be applied. There are products to be applied. Then we're just going to comb the hair of the patient. We converse with the patient to provide sympathy. And then we ask the patient to rate us in the comfortness scale. Sir, can you rate me from 1 to 10 in terms of comfortness? And that is all. Thank you.